we have a much greater body of evidence showing that cannabinoids can be used for this purpose, they haven't made their way into the mainstream doctor's office yet, and certainly not the pain medicine specialist. So this is a big part of the problem. Heroin addiction, overdoses, and deaths. This slide on the left here, I just want to point out the scale. The purple line shows the number of deaths per 100,000 people, whereas the blue line shows addiction rate per 1,000 people. So it's not that deaths are exceeding addiction, but we're having a pretty steep increase in deaths, even though we've had kind of a steady increase since 2007 of people addicted to heroin. Somehow the use pattern is changing and more people are dying. Also, if we look over here on the right, we can see this blue line is all drug overdoses, which has been pretty steadily climbing. And then this line down here in the green shows the overdoses involving any opioid. So really, So really what we see here is the overdose deaths related to all the other drugs just pretty much remain the same. And it's just the opioid overdose deaths that are increasing. And again, we can really do something about this. We have a great opportunity to change this. Number of deaths from prescription opioid painkillers over the last 15 years, and number of deaths from heroin. So we can see heroin is climbing steadily, but we're at around 11,000 deaths in 2014 versus 19,000 deaths from prescription painkillers. The prescriptions are still the biggest issue. Let's talk about how these two medicines work together. I really want to emphasize that the opioids and the products that come from the poppy plant, they are good medicine, and they're also a gift from the Creator to humanity. We just have to know how to use them appropriately, and perhaps some of the best use of the opioids is using them together with cannabis. So I'll show you what we know about that scientifically. First of all, cannabinoids and opioids work together. So the receptors for the opioids and the cannabinoids are present in areas of the brain that control pain signaling, also areas of the spinal cord. And there's crosstalk between these pathways. So at a molecular and cellular level, these two receptor systems are interacting with each other. Administering cannabinoids together with opioids results in a greater than additive anti-pain or anti-nociceptive effect, which means it's not just the opioid plus the cannabinoid. There's some synergy that's happening there. And I'll show you some of the animal experiments that help describe this. So if we look over here, these are dose response curves. We've got morphine on the bottom and what's called the percent maximum possible effect. So this is pain relief. And the higher we go up on this chart, the closer we get to the maximum amount of pain relief that the mouse can get from any dose of morphine. Here's the morphine-only curve. We reach the 100% mark when morphine is at about 100 milligrams per kilogram of body weight. That's a very high dose of morphine. If we look over here at the THC curve, we see that it's certainly not as steep of a curve, and this is oral THC. And I just want to point out how these mice are able to achieve about a 30% reduction in pain, because 30% is usually what's considered significant in the pain literature. And so this was a dose of 20 milligrams per kilogram of THC, resulted in 30% of the pain reduction. So if we come over here, we can also see about 20 milligrams per kilogram of morphine resulted in 30%. But when we look at this line, this is morphine plus THC. We can see that this same dose of morphine that gave 30%, when we added in the THC, raised it up to 100%. So what this means, just to show you the numbers here, so we've got 20 milligrams per kilogram of THC equaling 30%, of morphine equaling 30%. We put them together, we're not at 60%, we're at 100%. There's a pharmacologic synergy that's happening between these two medicines. This has been shown in humans. So this was an inpatient trial done by Donald Abrams, 21 patients with chronic pain that were on fairly high doses of sustained release opioids were treated in a hospital with extraordinarily low quality NIDA supplied cannabis via vaporizer 3 times daily. So again, this cannabis was only 3.5% perhaps. If they had some of the good medicine that's available, they would have had even better results. But still, just by adding these 3 vaporization sessions daily, patients were able to decrease their pain on average 27%. The next question I'll answer is, can cannabis be used to replace opioids in chronic pain patients? So we know that we can add the cannabis to help increase the pain relief, but can the cannabis replace the opioids? There's a study from this year that came out of Israel. It looked at 176 patients. 73 were taking opioids at baseline in the study. The patients were given 20 grams of cannabis per month, and they could choose if they wanted to smoke it, eat it in cookies, take it as an olive oil extract, or do some combination. They were told to use it 3 times a day, start low, and slowly increase until you find your optimal dose. And they were encouraged to decrease or discontinue their other treatments if they were able to. By the end of the study, 44% of the people that were taking opioids at baseline had completely stopped their opioids. By adding 20 grams of cannabis a month, they were able to completely stop their opioids. They also had improvements in pain and pain-related quality of life scores. So not only did they get off their opioids, their pain got better, their quality of life got better. Another study from 2016 showed similar results. This data came out of Michigan. 244 medical cannabis patients with chronic pain. And at the end of the study, they found, again, a nice decrease in opioid use. 64% had decreased their opioid dosage, decreased number and side effect of other medications, and improved quality of life by 45%. Just staggering numbers. There is really nothing else in medicine that can do this. There's nothing else in medicine that can do a fraction of this. At the end of my day in the clinic, I get around with my other providers and we talk about how many patients today did you see that stop their opioids or stop their benzodiazepines. It's just remarkable. Here's some data that I took from my own patients. We had over 1,000 patients respond who had used opioids. 70% of them used opioids for more than 3 months. But the patients I was really interested in were these 542 that had added cannabis to their opioid treatment. Of those 542, 39% had stopped opioids completely. And almost 3/4 of them had already been off the opioids for more than a year at the time that I asked them via survey. Another 39% had reduced their dose. And the really important outcomes here are that 47% reported that adding cannabis decreased their overall pain by at least 40%. 80% of them had improved function, and 87% of them had improved quality of life. So this is just staggering. These are people who have tried everything, who are taking a dangerous medication, even though they know it could harm them. They need some pain relief in order to survive, in order to function at work, in order to take care of their families. And I understand the position that most doctors find themselves in, who have a patient coming into their practice saying, "Doc, I need more of the oxycodone. I'm in too much pain. I can't sleep. I can't work. I'm going to lose my job. I'm not going to be able to provide for my family. Please give me 2 more pills a day." And it's really hard for a clinician who may be in this business to help people and to relieve suffering to not do anything for that patient. And I believe that the real solution to this problem is to give those clinicians another tool. Because right now they don't have a tool that's safe and effective, but they could. If this information gets out to them, they could have another tool that would be safe and effective, and they wouldn't have to prescribe the opioids, and they wouldn't have to feed into this problem that leads to heroin and leads to overdose death. Here's a great study that came out this year that looks at medical cannabis laws and how the effect that the laws in different states have on the amount of prescription drugs that are paid for by Medicare. And so what they did is they compared all the states that have medical cannabis laws to the states that don't. And they found that in the states that have laws, there are quite a few less prescriptions being filled. These numbers here are quite staggering. If we look at the pain category, okay, so this here is the changes in doses filled annually by one physician. So, for spasticity, there was very little change in the prescribing practices. In pain, there was a huge amount of change. So this is 1,826 fewer prescriptions per every doctor on average. These numbers are just staggering. Per physician in each state, this is how much fewer pain medications were prescribed in the medical cannabis state. This is a real change that's happening here. Just getting cannabis out there to patients, getting it into the awareness of people that aren't already using cannabis, but are looking for pain relief. It can make a huge difference. Is it safe to use cannabis and opioids together? Well, I've already shown you that patients are doing it and it seems to be helping them. Is it safe to do so? Well, here we have the ratio of the fatal dose to the effective dose of various substances. If you look down here at alcohol, we have a ratio of 10. So basically, if one drink gets you buzzed, then 10 drinks could potentially kill you. That's a very narrow therapeutic index. Cannabis, of course, is at the top of this chart because there is no lethal dose of cannabis. How is that possible? We have cannabinoid receptors throughout our entire body, including all over the brain. In fact, there's more CB1 receptors in the brain than any other receptor type, more than the dopamine receptors, or the glutamate, or the GABA receptors, more than serotonin receptors. They're really all over the brain. And here's an image of CB2 receptors, which are also everywhere throughout the brain, you can see, and also throughout the peripheral tissues. So there is one area of the body that has almost no cannabinoid receptors, and that area is the brainstem cardiorespiratory centers. We were designed so that there's no dose of cannabis that can shut down our brain's control of heart rate and breathing. There's no overdose of cannabis. So is it safe to use cannabinoids and opioids together? Well, because the opioid and cannabinoid receptors are found together in areas of the brain that control pain, but the cannabinoid receptors are absent in the areas that control breathing and heart rate, the combination treatment actually increases the therapeutic index of the opioids because the lethal dose remains the same, but when you add the cannabis, the effective dose goes way down. So we have this much wider window where people can be treated with both opioids and cannabis and remain safe. So I used to have a very black and white thought process about opioid prescribing for chronic pain. I thought it's bad, it leads to addiction, it leads to tolerance and need for dose escalation. And now my thinking is a little more gray because I see that the combination treatment is actually the best thing for some patients. It doesn't just end there. It literally keeps getting better and better. So retention of efficacy. Opioid receptor proteins were found to be upregulated in the spinal cords of animals that were treated with both cannabis and opioids. So the animals that get the opioids alone, they lose their receptors. The receptors become downregulated and they're no longer as sensitive to the opioids because the cells don't have those so-called keyholes for the opioids to fit into. The opposite thing happened in animals that received both the cannabinoids and the opioids. These mice were able to avoid tolerance and retain the pain-relieving effect of the opioids over time, as long as they were treated with both cannabis and morphine, or I should say THC and morphine. The cannabinoid and opioid receptors are also found together in brain areas that we know are important for morphine abstinence, like the nucleus accumbens, the septum, striatum, and the periaqueductal gray, and the amygdaloid nucleus. So we're not just retaining the pain-relieving effect, we're likely also retaining an effect that would prevent seeking behavior, drug-seeking behavior, and prevent other factors that would lead to misuse or abuse of the opioids. Cannabis is an incredible option for people that are currently taking opioids. Let's take a look down here. Actually, I want to just tell a quick story about this. When my thinking started shifting about opioids as a treatment for chronic pain, it was when I was in residency. And I would see a lot of patients coming back asking for more opioids, and it was a big problem. It was a big part of my training, how to deal with this. And it seemed to me like it was the bane of every primary care provider's existence. Their work, it was a major issue. And then every once in a while I saw a patient come in that had been on the same dose of opioids and wasn't asking for more. And when I would look at